Good morning. Today I will start describing the vertebral column and the bony thorax. As you know, the vertebral column and bony thorax almost form from 34 to 56 bones in different adult animals. Usually it's extend from the skull to the pelvis. The most important function to transmit the weight of the trunk to the lower limb. And usually the vertebral column surround and protect the spinal cord, and the bony thorax also surround and protect the heart and the lung. For the vertebral column, as I said, it's extend from the skull toward the caudal vertebra, and usually they divide it into region. We have the region that found in the neck region, they call it the cervical vertebra, and then the one that found in the thoracic region, call it the thoracic, and we have the found in the abdomen, we call it the lumbar, and then the area that found between the pelvic bone, we call it the sacral, and finally we have the one that found in the tailbone, we call it the caudal vertebra. And usually they give the abbreviation C for the cervical vertebra, T for the thoracic vertebra, L for the lumbar vertebra, and S for the sacral, and for the caudal they give it the letter CD to differentiate it from the cervical vertebra. So we start from the cervical, thoracic, lumbar, and this area here we have the sacral, and in the tail we have the caudal vertebra. So again, start from the skull toward the tail. The first one here, the cervical, from here to here, the thoracic, from here to here, the lumbar, and then we have the sacral, and the one that found in the tail, we call it the caudal vertebra. The number of the vertebral column and vertebral formula different from one species to other species. For example, if we start with the carnivores or carnivores, in the cervical region we have 7. In the thoracic we have 12 to 14, and usually we say like almost 13. In the lumbar we have 7. In the sacral we have fuse 3 sacral, and in the caudal we have between 20 to 23. And this we give it the formula C7 for the dogs, T13, lumbar 7, S3, and for caudal between 20 to 23. For pigs 7, for ox 7, 7, 7 for cervical vertebra. So we can see from here that for all animal species, the number of the cervical vertebrae, no matter how length is their neck, the number is 7. Even in giraffe, the number is 7. In the thoracic, mostly there are 13, except for the horse with 18. For the lumbar, we have 7, 5 to 7, 6, 6, and 5 to 7. For the sacral, we have 3 fused vertebrae. We have 3, 4, 5, 4 to 5, and 5. And for the caudal, between 20 to 23, 20 to 23. In the ox, 18 to 20. In the small ruminant, 13 to 14. In the horse, between 5 to 21, depend on the species. So the formula, for example, for the ox will equal C7, thoracic 13, for the lumbar 6, for the sacral 5, and for the caudal will be 18 to 20. Generally speaking, just memorize that the number of the caudal vertebra between 15 to 23. I don't want you to memorize it for each one specifically. Now we are going to talk about the typical vertebral anatomy. For the typical vertebral anatomy, it consists from the body. This one, we see it here. This is the body. It's found in the ventral portion. And then we have this arch. And this arch here, we have the wall and we have the roof. For the wall, we call it as the pedicles, and for the roof we call it the lamina. So we have the body here and we have this arch. At the middle of the vertebral arch we have this spine, and this we call it as the spinous process. And you can see at this area here, between the junction between the vertebral arch and the body, we have two processes, and these we call them as the transverse process. So we have the body, we have the vertebral arch. The vertebral arch consists of the pedicles, and we have the lamina. At the middle of the arch we have the spinous process. At the area of junction between the vertebral arch and the body we have the transverse process. Also we have the cranial articular surface, and in the back we have the caudal articular surface. So we'll start with the cervical vertebra. Usually they give the abbreviation C1 to C7. They are the smallest and the lightest vertebrae. Usually the C3 to C7, they are considered as a typical cervical vertebra. They have bodies, they have vertebral arch, they have spinous process, and they have the transverse process, cranial and caudal articular surface. Their body is small, wider side to side. They have the spinous process, short and pivot, except for C7. The vertebral foramen large and triangular, and we have the transverse process contain the transverse foramina. Usually the transverse foramina found between C3 and C6. C7 don't have, or it does not have, the transverse foramen. So this is the C1, C2, C3, C4, 5, 6, and 7. See this one here, 1 and 2, they are considered as atypical, abnormal vertebra. C3, C4, C5, C6, C7, they are considered as typical vertebra. They have spinous process, they have transverse process, okay, and they have their body. C1 and C2, as I said, they are considered as atypical vertebra. So this is the cervical, this is the body, and this is the cervical or vertebral canal, and they have the spinous process, and here we have the transverse process and the foramina that we can see here. This is the transverse foramen. As I said, C3 to C6 they have this foramen. C7 does not have this foramen, so it's easier to differentiate C3 to C6 from C7, but we could not differentiate between C3 till like C4, C5, C6 because they are almost similar. However, C7 does not have the transverse foramen. So we'll start with this one. This is the C1, this is the C2, and then we have the C3 till C7. See this one, this is the C1, the C2, they are considered atypical. You can see there's the difference in the shape comparing between them and C3 to C7. Again, this is the C1, C2, and these are from C3 to C7. So the first one, which is the C1, other name is the atlas. This is the atlas, and you can see here they lack the body and the spinous process, so that's why they are considered atypical, because they don't have nor the body or the spinous process. The second thing, there is no the intervertebral disc between the C1 and C2. The most important function of the C1, they support the skull and they form a joint between the vertebral column and the skull through the occipital bone, and this joint is the atlanto-occipital joint between the atlas and the occipital bone of the skull. The C2, the other name is the axis, C2, so when I say C2 means the axis, C1 is the atlas. Okay, the most prominent feature of C2 is the ridge-like appearance of the spinous process, and we can see here we have the body of this vertebra, and we can see this structure that project cranially. This is a cranial. Okay, this we call it as the dens. Typically, in the cervical vertebra from C3 to C7 will not have this structure, even in the C1. Now we'll start with the vertebra found in the thoracic region, which is the thoracic. As I said, we give it the abbreviation 1 to 13, except in the horse, 1 till 18. The importance of the thoracic vertebra, all of the ribs will articulate with the thoracic vertebra. The most prominent feature, they have long spinous process and they have short transverse process. Usually these processes, the spinous process, project caudally, except for number 11 will be perpendicular, and number 12 and 13 in dogs will be project cranially. This one we call it anticlinal vertebra because they don't cline neither for cranial or caudal. Usually we have the vertebral foramen will be circular. Each side we have the demifacet, and this is very important for the articulation with the ribs. So this is the area, this is the spinous process, this is the transverse process, and this is the body. And you can see here we have this area here, this is cranial and this is caudal. This is called, this one here, the cranial costal fovea, and the one that found here in the caudal, we call it caudal costal fovea. The two together, the caudal and the cranial, they form the semilunar surface. We call it the demifacet. This one here, this one here, this one here. This is the caudal and this one the cranial costal fovea. Two together they form that demifacet, and this is very important because it's the site for the articulation of the head of the ribs with the bodies of the thoracic vertebra. So again, this is the spinous process, and here we have the transverse, and here we have the body, and this area here and this area here we have the caudal costal fovea, and the one that you see here cranially, this is the cranial, and this one here is the caudal costal fovea, and this one here, this is the transverse process. Again, this is the spinal process, and this is the body, this is the cranial, and this is the caudal costal fovea, and this is the area of the transverse process. They have also area for articulation with the ribs. We call it as the transverse costal fovea. So this one here, cranial costal fovea, this one here is the caudal costal fovea, and the one that found in the transverse process, we call it the transverse costal fovea. Also we have here at this area here, this one here, and this is the cranial articular surface, and the one that we have in the back, that will be the caudal articular process. See this one here, this is the spinous process, and these are the ribs. As we can see here, the ribs articulate with the thoracic vertebra. This is the ribs. Again, this is the area of the ribs, and we can see here they articulate with the thoracic vertebra. They will articulate the head with the demifacet that form from caudal and cranial costal fovea, and the tubercle going to articulate with the transverse costal fovea. For the lumbar, we have from L1 to L5. Usually the body is large, kidney shape. The transverse process are thin and tapered, and the spinous process are short, thick, blunt, and point caudally. This is very important to differentiate between the lumbar vertebra and the thoracic. We look for the transverse process, and we can see that the transverse process in the lumbar will be long compared with the thoracic vertebra. See this one here, this is the area of the transverse process, and this is the area of the body with the kidney shape, and here's the vertebral arch, and here we have the spinous process, and here we have the cranial and caudal articular surface, and this area here, the vertebral foramen. You can see here, this is the spinous process, and this one here, these are the transverse process of the thoracic vertebra. And the area here between the bodies, we call it as the intervertebral space, and usually in this intervertebral space we have the intervertebral disc. Now going to the sacra, from S1 to S3 is very easy to differentiate because they are fused together. There's no any separation between the sacral bone, and usually depending on the species, maybe you have 3 fused sacra or 5 or 6 depending on the animal species. See, this is the area of the pelvic girdle, and the one here, this is the sacral. They are fused together. We could not break down them or separate them from each other. They are called the sacral vertebra. In the ox, see this one here, almost like T shape. This is the area where the bones are fused. Even the spinous process, they fuse together. Okay, and this is the cranial portion, and this is the caudal portion. The foramen here, we call them as the dorsal foramen, and from the ventral portion, we call them as the ventral sacral foramen. And this area for fused all structure, for all the spinous process, we call it as the median sacral crest. In the heart, again, they are fused bone, but you can see here there is a space between the spinous processes, not completely fused as we see it before for the ox. This one for the horse, and the one that we saw before is for the ox. For the caudal vertebra, also called the tailbone, they are small triangular bone formed from 15 to 20 vertebrae, offer slightly support to the pelvic organs. It's not as important as the one that we see in the cervical or thoracic or lumbar or the sacral region. So this is the one here. We have the sacral, and the one, the small here, we have the caudal vertebra. Between the bodies of the vertebra, we have a structure, we call it is the intervertebral disc. This is cushion-like between the vertebra to responsible for the shock absorption. When we move, there is a shock happen between the bodies of the vertebra. This structure is very important to absorb this shock. Usually it consists of a central soft tissue, and in the periphery we have the fibrous tissue, like ring of fibrous tissue. So this is the soft tissue, and this is the fibrous ring. And usually they consist of the fibrocartilaginous connective tissue. We'll talk about later. So we have soft tissue and we have the ring. And usually, as I say, this is the soft tissue and this is the fibrous. Annulus mean ring, fibrous ring. And usually the location is found at this area here. See, this is the area between the bodies of the vertebra. Any displacement or change in the location of these vertebral discs may affect the spinal cord. This is here the spinal cord, and this, if these intervertebral discs displaced toward the spinal cord, may cause a spinal cord injury and a lot of pain, and may cause paralysis if not treated. See, this is the spinous and this is the body, and this area here is the area where we have the intervertebral disc. Now we'll talk about the bony thorax. It forms a framework of the chest. The component, dorsally we have the thoracic vertebra, laterally we have the ribs, and ventrally we have the sternum and the costal cartilage. The importance of the thoracic, bony thoracic, to protect the thoracic organs, the heart, and the lung, and support the shoulder girdle and the upper limb, and provide attachment site for the muscle. Several muscles that start from the thoracic limb, the forelimb, is end in the bony thorax. So this is the dorsally, as I said, we have the thoracic vertebra. Ventrally, we have the sternum, and laterally, we have the ribs. That's the boundaries of the thoracic cage. For the sternum, it's composed from 8 unpaired segments called sternibra. These sternibra joined by a cartilage, we call it intersternibral cartilage. The first one we call it manubrium, and the last one we call it the xiphoid process. See this one here? This is the sternum, consists of 8 unsegmented bone, 8 unpaired, found in singles. Okay, the first one is the manubrium, and the last one is the xiphoid. Each one of these bones separated from the adjacent bone through a cartilage. See this cartilage here? This cartilage here, we call it the intersternibral cartilage. So each one of these bones called sternibra, the cartilage between them, the intersternibral cartilage, the first bone or sternibra, we call it manubrium, and the last one is called the xiphoid. Again, see these, the bones, sternibra, and between them we can see this cartilage, which is the intersternibral cartilage. The first one is the manubrium, and the last one is the xiphoid. Again, this picture here, we have the sternibra. Between them, see this area here, 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 here. All of that is the intersternibral cartilage. Now we'll talk about the last thing, which is the ribs. Ribs, we have 13 pairs from form the sides of the thoracic cage. We have one rib right side, we have the other rib in the left side, and we have the total of 13 pairs. And the number of the ribs depend in the number of the thoracic vertebra. So if we have 13, then we have 13 pairs. In the horse, we have 18, then we have 18 pairs. All the ribs attach to the vertebral column dorsally through the costal fovea or the transverse costal fovea. They divide the ribs in the dogs and human into true ribs, false ribs, and float ribs. The true ribs, the cranial 9 pairs of the ribs which attach directly to the sternum by the costal cartilage, we call them as the true ribs. The false ribs, which remaining 3 pairs, 10, 11, and 12, that attached indirectly to the sternum, we call them as the false rib, and the one that does not have any attachment with the sternum, we call it as the float ribs. So here, see this one, 2, 3, they attach directly to the sternum. Till 9, these we call them as true ribs. However, number 10, 11, and 12, they form the costal arch, which then articulate with the sternum. We call these 3 as the false ribs. And you can see the last one, which does not have any connection or articulation with the sternum, we call it as the float ribs. See here, each one of these are the sternibra, and between these sternibra we'll have the intersternibral cartilage. For the ribs, it consists of body. We have the area of the head, we have the area of the neck, and we have the area of the tubercle. And this is the typical anatomy of the ribs, which consists of shaft or body. We have the head, below the head always we have the neck, and we have the tubercles. So the most dorsal end, which is the head, the constricted portion beyond the head is the neck, and tubercles, which articulate, very important, with the transverse process through the transverse costal fovea. So again, this is the area of the head. Then we have the neck and we have the tubercle. Usually the head is going to articulate with the demi-facet, which formed by the caudal and cranial costal fovea, whereas the tubercle is going to articulate with the transverse costal